Welcome to this video in which we are going to talk about three common conditions in newborns. Number one, nappy rashes. Number two, neonatal conjunctivitis. And number three, oral thrush. Now, nappy rash is a very common thing in most newborns. These are red, inflamed patches around the genitals, on the thighs, and on the bottom. A nappy rash can appear as dry or moist, shiny, and also pimply. Now, nappy rashes happen because of the contact of the skin with moisture or wetness that comes from the urine and the stool of the baby. Now, all of us know that newborns have frequent urination and pass stools more frequently. So obviously that area is exposed to a lot of wetness and to a lot of moisture. Sometimes a nappy rash can also be allergic in origin, an allergy to wet wipes, an allergy to diapers, an allergy to a cream that the mother may be using in the nappy area. Now, most nappy rashes usually settle down in 4 to 5 days' time. However, if the rash starts to look nasty, smelly, weepy, and you find that the baby is very uncomfortable, then please take your baby to the doctor because you must rule out things like a fungal infection or a bacterial infection in that area. Now, the treatment of nappy rash is very, very simple. Number one, change the baby frequently, so that their skin is contact with dry diapers instead of wet diapers. Number two, open the baby and leave the baby without the diapers for a good period of time during the day. Let the skin breathe, let the skin be in contact with air to dry. And number three, apply a thin film of a barrier cream, a nappy rash cream, or even petroleum jelly. Now, a number of times, I find mothers using thick layers of creams in that area. There is no need to do that. Just a fine layer is enough. Some mothers use talcum powders in that area. I personally discourage that because powder, when it gets the moisture from the urine and the stool, it tends to form crusts that can get into the creases of the skin and cause more problem than good. The next condition we are talking about is neonatal conjunctivitis or conjunctivitis in the newborn. A lot of times, a few days after birth, you might notice a little pink eye in the baby with a whitish or a yellowish discharge. Now, you've got to appreciate the fact that when the baby comes out of the birth canal, the baby is exposed to a lot of viruses and bacteria in that area. And it is not uncommon for a little bacteria or a virus to get into the eye of the baby. The treatment is fairly simple. All you need to do is just keep the eye nice and clean with warm water and cotton. However, if the discharge persists, if the eye looks sore and it's getting worse, then you take the baby to the doctor because in that case, the doctor might prescribe some eye drops for the baby. The second condition connected to the eye is called blocked tear duct. In the following weeks after birth or following months after birth, you might find that the baby tears a lot, either in one eye or both the eyes. Now, there's a gland right on top of the eye, which is called the lacrimal gland, which secretes tears. And tears come out from the gland and cover the eye and is like a lubricant between the eyelid and the eyeball. And then the tears go to the angle of the eye and drain through a small channel to the back of the nose. Now, in some children, this connection between the eye and the back of the nose is a bit tight. So the tears that are coming from the top cannot go through the channel and start to drop out. And this is just a clear, watery discharge. Now, usually with age, as the baby grows, the duct opens up. In a few months' time, it settles down. However, if by 1 year of age, it's not settled down and it's not opened up, then you need to take the baby to the eye doctor and they perform a very simple procedure to open up that channel or that canal. The third condition we are going to talk about is oral thrush. Oral thrush is caused by a fungus called Candida albicans. Now, Candida albicans, all of us carry Candida albicans in our system. But in certain cases, if the baby's immunity is low because of an illness or because of the use of antibiotics, then the good flora or the normal flora of the intestine gets depleted and the fungus gets a chance to grow. And it appears as white patches inside the lips, on the tongue, and the sides of the mouth. Now, unlike milk stains that can be removed easily, the fungus is difficult to remove. And don't try to remove it because it can be painful and sore. Now, also what happens is, in breastfed babies, if there's an oral thrush, the baby gives the thrush to the mother at the time of feeding. So now, not only the baby, but the mother also suffers from Candida, and the nipples get cracked and sore, and sometimes they even bleed. So in this condition, both the mother and the baby need to be treated. The treatment for oral thrush is fairly simple. The doctor either prescribes some mycostatin drops for you, or may write an oral gel, like a Duct and oral gel, to apply in the baby's mouth. At the same time, make sure that you ask the doctor to treat you as well, because you don't want the infection to pass on between yourself and the baby. So these were 3 common conditions that we discussed in this video, and I shall see you in another video soon. Thank you.